Good afternoon, everyone. I'm Brie Oliver. I'm the Executive Director of Healthy Mothers, Healthy Babies, the Montana Coalition, and I'd like to welcome you all to today's Safe Sleep Initiative announcement. We are thrilled to be part of the First Years Initiative, and we're excited to share the campaign with you. Safe sleep is not new to family education, but this campaign reframes the approach in a way that is accessible, positive, and empowers families to make the choice best suited for their situation. We worked with stakeholders across the state, current Montana families, to learn what the needs are and how we can support them. We found that the families felt that they knew the guidelines, but also felt shamed when something prohibited them from following it to the letter. Parents have enough on their minds when a new little one joins them, and complicating their days was just not what we wanted to do. The campaign is a direct result of those meetings. To do this, we shifted from a black and white stance on safe sleep to one which aims at harm reduction and opens conversations between families and providers. The idea of expanding messaging to families rather than to simply mothers was repeated, and we heard you. As a result, all of this resulted in the educational campaign materials with the theme Safe Sleep, Learn, Plan, Provide. The media campaign materials can be found on the Healthy Mothers, Healthy Babies website. The campaign does not ignore the realities of bed sharing and instead promotes open conversation and tips for reducing risks associated with unsafe sleeping situations. It also respects cultural differences in traditional sleep positions. The Department of Public Health and Human Services has been a critical partner in this process, and I would like to introduce you to Deputy Director Laura Smith and have her tell you a little bit more about this effort.
Thank you so much, Brie. As we were just saying before the event started, this is a really exciting moment for us in time. We were both talking about memories of sitting around a table at DPHHS and thinking about how we really enhance our partnership to help and serve families in Montana. So we appreciate all of your work, and we're excited about moving forward as well. More than 3.5 years ago, Director Sheila Hogan and I started at DPHHS, and we've worked together over time to support kids and families across Montana. There are two main pieces of our goal that we really walked into this with: ensuring that we're making data-driven decisions and braiding resources within our department and with stakeholders as we leverage to support and improve the lives of children and families across Montana. One excellent example of this partnership is with our First Years Initiative that was launched 3 years ago. Our focus with the initiative was really to support families, particularly with young children, as we know that there are higher risks associated with their vulnerabilities, and that these families are needing our support as they move through this challenging period of their lives. The highly successful initiative combines our agency's home visiting program with child and family services to ensure families across Montana have support and resources as they're moving through that time. Today, we're really excited to highlight the third pillar of the First Years Initiative, which is the Safe Sleep Initiative. And with that, I'd like to turn things over to Director Hogan to explain more.
Thank you, Laura. As Laura mentioned, it was just a little bit over 3 years ago that we launched the First Years Initiative. As an agency, data tells us that children under 2 are most vulnerable to fatalities, especially sleep environments. The goal of this initiative is to reduce child abuse, neglect, and child deaths in Montana, issue-specific through early education, prevention, and services. We took action. The First Years Initiative focuses on providing targeted resources, education, and services during the critical periods in the lives of children and their parents, from pregnancy through the first years of the child's life. The first phase of the First Years Initiative was the home visiting collaboration. Through federal funding, we've been able to work with current established home visiting programs in a public-private partnership with health departments and nonprofits to hire additional home visitors whose sole caseload is to work with at-risk families. We now have new home visitors located in 13 sites across Montana, working alongside child protection specialists. The second pillar of the initiative was a public-private partnership with the Montana Healthcare Foundation, focusing on prenatal and postpartum care for women with substance abuse disorders. Today, we are talking about the third pillar, the Safe Sleep Initiative. The effort has provided 1,500 pack-and-play cribs over the past several years, and now new safe sleep education materials to at-risk families and a media campaign to increase awareness. We are grateful for the partnerships who are supporting the initiative, and they are the Montana's Children's Trust Fund, Healthy Mothers, Healthy Babies, and DPHHS. I appreciate these partners and everyone who has helped us with the Pack and Play to support families across Montana. These Pack and Plays are distributed to local Child and Family Services divisions, women and infants and children WIC clinics across the state, tribal health programs, home visiting locations, and American Indian reservations. One of my top priorities is supporting safe and healthy childhoods for children across Montana. Through this initiative, we have taken tangible steps toward the goal by prioritizing intervention, education, and preventing tragedy. And we couldn't do it without the partners that I talked about. Today's announcement goes a long way into supporting families, sharing knowledge about safe sleep, and making sure children are safe. I'd now like to introduce the Lieutenant Governor, but before I do, I want to share a little secret about him. He is on baby watch. He's waiting for his new grandchild. It could happen any minute, but he's here with us today. Lieutenant Governor.
Thank you all very much. It's great to be here. Now, and we are on baby watch. That's why I have my phone right here. My daughter went into, we believe she went into labor. They put her in and we're just waiting. So this is our first. So I'm very excited, very excited. How appropriate that I'm here today doing this. And I also want to say, and it wasn't mentioned, but I used to have Brie's job at Healthy Mothers, Healthy Babies. And I can remember when we first started having discussions with the Department of Health and Human Services about being a partner in the Safe Sleep program. And we were helping purchase those and get them distributed and get them to families who really needed it. So I can't tell you how excited I am to be here today. So thank you. You know, it is a privilege for me to join you all today to help relaunch and to launch the Safe Sleep Initiative. This initiative is just another example of how we're working to ensure children start life safe and healthy. The idea was to distribute 700 cribs, but we've doubled that goal. Now, with the launch of new educational materials and a media campaign, we're also asking more partners to join us. This will help us reach even more families with newborns. Now, to be clear, this announcement represents more than these cribs and the media campaign. It's a statement about safe and caring. It's a statement about what we as Montanans can do to ensure families with newborns will have the best start in life and a safe place to sleep. And I think this is a message we can all relate to. Even if you don't have a newborn at home right now, it's like you're an aunt, you're an uncle, or perhaps a new grandparent, an expecting grandparent, or a friend who will help care for a baby at some point. We all need to learn about safe sleep and the latest safety information. How your parents or grandparents put their children to bed might not apply today. We must learn the proven methods that exist to ensure children are protected at their most vulnerable time when they sleep. But that isn't enough. And I think we all know the challenges associated with being a parent. And one of those challenges is the financial stress. For any parent, this can be daunting. We must help provide adequate tools such as these cribs to those who may not be able to afford one. This is about making safe sleep easier for all families, regardless of their financial situation, from the first day they bring their child home, by making sure they have access to a crib and information to make sure they're keeping the crib safe. Every child deserves safe sleep. And I'd say today we're doing just that. I remember from my own experience that being a new parent is not for the faint of heart. And I got to tell you that's true today as well. So any chance that I have to support new parents, I'm all in. To me, it's a very powerful statement that over 1,500 children are already sleeping in these cribs and that the number continues to grow. Think about that for just a moment. The impact that we're making and the impact that we can continue to make. Maybe they'll be used by a future brother or a sister or a cousin or passed on to another family member. This ripples within our communities, and the ripples are potentially boundless. This is certainly a great investment in our youth and in our state and in our future. I share Director Hogan's focus on building partnership and enhancing collaboration across stakeholders. By working together, we can do more and are doing more for the children and families of Montana. Thank you all for being here. I appreciate all of those who helped make today possible. Let's keep this good work going forward. Thank you all very, very much.
Thank you so much, Lieutenant Governor Cooney. It's certainly an honor to be walking on the shoulders of giants like you here at Healthy Mothers, Healthy Babies. And I know I speak for all families in Montana when I say thank you for your continued support of initiatives such as this one that help the next generation of Montanans have a safe and healthy life. Next, I'd like to welcome Dr. Cathy White. She's a pediatrician with the Southwest Montana Community Health Center and the president of the Montana chapter of the American Academy of Pediatrics. She'll share some of our latest research on safe sleep guidelines and a story about how this initiative is going to reduce Montanans' infant mortality rates in sleep environments. Please welcome Dr. White.
Thank you, Brie, and thank you, Lieutenant Governor Cooney and the DPHHS for your continued support of families' health issues. We're happy to partner with you. I wanted to first share some safe sleep guidelines that are considered to be the most critical for infants today. The first is that babies should sleep on their backs. When I started in pediatrics 30 years ago, it was recommended that babies sleep on their stomachs. But research has since proven that that can be dangerous, and babies should always be put to bed on their backs. And many times I have this conversation with people in my office because I may have a grandparent who has one view and a parent who has another, and we have to talk about how medicine changes and what research does for us. So usually by the end, everybody's in agreement. The second thing is the actual sleep environment. The Pack and Play is a great safe sleep option. When you use it, accompanied with the sheet that comes with it, it is firm, free of bumpers, toys, and loose objects, and the bedding fits snugly across the mattress. Although I cannot recommend co-sleeping, it would be ridiculous to judge parents who want the best for their children and are working to provide that. As such, there are things we can do to reduce the risk of sleep-related deaths and co-sleeping if it occurs. For this situation, the bed should meet the same standards as the crib environment, and the babies should be placed on their back. Beyond this, the importance of remaining sober and smoke-free cannot be overstated as critical components for safe sleep. There are, of course, more specific recommendations available, but I will leave them for the Healthy Mothers and Healthy Babies resources. As you can see, there are lots of them, and we're hoping that those can be handed out and people can look at the guidelines even more closely. As this campaign begins, it is important to realize how important an initiative this is. I would like to relate a story told to me last year by a pediatric cardiologist. He said, "Please tell everyone my story, as I have to live with it every day, and if I can save even one life, it is worth it." He said he came home from being on call and was exhausted, but he so wanted to hold his lovely baby, and so he sat down in the recliner, and when he woke up hours later, his baby was dead. He had rolled over on him. He said, "I tell people every day about safe sleep." He said, "Even though it was an accident, it doesn't make it any easier to live with it." He said, "Accidents can happen to anyone, but if you follow safe sleep practices, they're less likely to occur." He said, "If you are tired and put your baby in their bed and wait until they're more alert to hold them." I hope this exemplifies how important these safe sleep guidelines are for everyone. Thank you again, Lieutenant Governor Cooney, for your support for such a critical topic, and good luck with your grandbaby.
Thank you to all of our speakers today. Thank you to DPHHS for this incredible partnership and helping us more than quadruple our reach with crib distribution. Thanks to our Healthy Mothers, Healthy Babies staff and board and volunteers for helping us scale up so quickly and do this work. And we're just so joyful about all of this. So thank you everybody for coming, and that concludes our launch initiative.